Hi everyone, welcome back to Veterinary Clinical Anatomy channel. Today we are exploring a fascinating topic, the Ductus Arteriosus in an 11-day-old puppy. This is the heart of an 11-day-old puppy viewed from the left side. This is the right auricle and this is the left auricle. The left ventricle is visible and cranial to it lies the right ventricle, forming the cranial border of the heart. Here is the aortic arc and this is the descending aorta. The first branch arising from the aortic arch is the brachiocephalic trunk, and the next is the left subclavian artery. This major artery located lateral to the aorta is called the pulmonary trunk. The pulmonary trunk divides into the short left pulmonary artery, as you can see here, and the longer right pulmonary artery, this one. Then we turn to the left side. Between the aorta and the pulmonary trunk lies a communicating artery called the Ductus Arteriosus, which connects the pulmonary artery to the aorta. From the late fetal stage until 15 to 18 days after birth, this communication remains open, allowing blood to flow between the systemic and pulmonary circulation. Now I am inserting the probe into the left pulmonary artery and guiding it from the pulmonary trunk into the aorta through the Ductus Arteriosus, indicating that the Ductus Arteriosus is still open in this 11-day-old puppy. As you can see here, the probe easily goes from pulmonary trunk to the aorta. Thanks for watching. If you found this video helpful, don't forget to like, subscribe and share it with your colleagues or classmates. Got questions or topics you'd like us to cover? Drop them in comments below. See you in the next episode of Veterinary Clinical Anatomy.